Good, Bill. Thanks.
Excellent. Well, this is the industry that I specialize in. This is all I do. I own a health insurance agency. And if we can make a couple comments here so that maybe we can understand where this is going, because I got 100% skin in this game. Number one is we do need to nationalize the rules of the industry, no doubt. And based on that, if they do that, then what we can do is the insurance companies that can qualify for that, then the government will be the reinsurer. And with all that, we basically say everyone has to have insurance, and it'll be based on what they make and so on and so forth. And we can simplify the system. And then basically, with the rules that the government's going to put in place, we'll reduce the cost by 40%, and this will work. And that's why we're just so confused on what's going on here, because first of all, it seems like they don't even know that the system is run on a state-by-state basis. That's the number one thing that needs to be fixed. We need to nationalize the rules of the industry so there is no junk insurance out there. And I'll sit back and answer any questions and listen to what you got to say.
Representative Fleming, do you want to address that?
Yes, I think the gentleman makes some great points. The health insurance laws that we're under currently were created in the 1940s. They're archaic. They don't allow for large risk pools. And also what he's getting at is a large chunk of the 47 million uninsured Americans actually are healthy adults who opt out of the system. And what he's suggesting is we need to strongly incentivize them, get their dollars in the system, and in turn, that will lower the cost of everyone in the system as everyone participates.
But could I ask, though, Congressman and Bill on the phone, Bill, where do you see in your business, where do you see the large cost coming from?
Well, the large cost comes from basically the system is way too complicated. There's way too many plans. There's way too much paperwork. I mean, it's just crazy because the rules are basically different from state to state. We need to simplify the process, make it, I mean, really, who cares if you have an HMO or a PPO or a POS or an HSA or, I mean, when it comes down to here is we just need to simplify the process so that there's just, because the more you put your hands on something, the more it costs.
But Bill, wouldn't you agree, though, I mean, you just rattled off various health care plans, wouldn't you agree, though, that shifting behavior, causing persons to perhaps pay some of their own health care, Joe Clark mentioned, and so did the very good commentator from Chicago Sun. I mean, there's a lot of waste from utilization, and so wouldn't you want to drive how people utilize the system as well? Yes,
we need to definitely make, everyone has to go in for a wellness visit. We need to make that mandatory and stop, you know, some of the elective stuff that actually goes down. You know, make things mandatory. That's part of the nationalization of the rules of the industry that we need to fix.
Well, and nobody is touching what is now, frankly, the third rail in politics and everywhere else, and that's the obesity epidemic in this country. Because, again, how are you going to fix it? Is it going to be the heavy hand of the government that puts pressure on people to live healthily? Is it going to be people who are obese paying more for their health insurance?
Well, yeah,
nobody wants to talk about that.
I mean, I look at this, by 2013, and someone could correct me on this, but by 2013, over 50% of our population is going to be over age 55. Okay, we're about, as tremendous healthcare costs are now, with our aging population, it's going to get far worse. And I'd like to ask the Congressman, where would the money come from under the President's plan? You know, the individual income tax increases in the President's 2010 budget is going to increase individual income tax revenue in this country by $980 billion next year.
We have to answer that after the break, Congressman, because again, that answer could take, well, a couple of hours.
Yeah. Next day or two.
Congressman, we'll be right back. We're still looking for more of your questions. 877-249-9626. The email address is yourmoney@foxbusiness.com.
Saturday mornings, we're up, we're here, and it's all about you on the Fox Business Network. And we're the only business network up answering your questions about your money in true HD.